Elizabeth, and good afternoon, and thank you everyone for joining us. Let's get right into the numbers that describe where we're at with the pandemic today. Our current 7-day average is 641 new cases, and today we are reporting 732 confirmed cases, bringing our total cases of COVID-19 to 592,994 people. 4 more Wisconsinites have died, bringing the total number of lives lost to COVID-19 in our state to 6,725 people. Our hearts go out to their families and to their friends, and it's a reminder again that we must commit to stopping the spread. So please keep wearing your masks and physically distancing, and please get vaccinated. So as we turn to that topic of vaccination, as of today, we have administered 4,057,602 doses of COVID-19 vaccine in our state. 4 million doses in 4 months. I want to give a huge thank you to all of our vaccinators who have put those 4 million doses into your arms, and to all of you who have stepped up to get vaccinated. 2,392,870 of our Wisconsin friends and neighbors have received their first dose of vaccine, and 29.7% of Wisconsin residents have completed their series. For residents aged 65 and older, 79.9% have at least 1 dose, and 73.1% have completed their series, which is great progress for the group of people most at risk of dying from this disease. 4 million doses down, and about another 3 million doses to go to reach 80% community immunity. With everyone age 16 and older eligible, I know it can still take some patience and perseverance to get an appointment for a vaccine. So I wanted to share a new tool with you, vaccinefinder.org, that will help make that process easier for those of you who are just getting ready to start your vaccine journey. The CDC launched Vaccine Finder in March, and DHS and providers across our state have been hard at work this past week testing the tool and making sure the information within Vaccine Finder is correct. When you go to vaccinefinder.org, click on Find COVID-19 Vaccines, then enter your zip code, click Search, and you'll see a map with all the vaccine providers in your area. You'll also be able to see the providers' days and hours of operation and a green in-stock check mark, which tells you that they have vaccine available at that provider. And if they don't, you'll see a little sign that says out of stock. Clicking on that provider name will give you the information you need to schedule an appointment, either through a website or by providing a phone number to call. In addition to helping you locate a vaccine provider that is both near your location and has vaccine in stock, Vaccine Finder can also filter by vaccine type. Because the Pfizer vaccine is the only one authorized for use with 16 and 17-year-olds, the ability to search specifically for Pfizer will be especially helpful for families looking to vaccinate their eligible teens. As you make an appointment, remember that you may be asked for insurance information, but if you do not have insurance, you will not be charged. If you do have insurance, your insurance may be billed for an administration fee, but it cannot be passed on to you. You should not have to pay anything out of pocket for a COVID-19 vaccination. The vaccine itself is free of charge to you as well. Because the Pfizer and Moderna vaccines require a second appointment, be sure to plan for that right away because it's best to get your second dose from the same provider who gave you your first dose. That way our vaccine distribution works, and it is very helpful when you stay with the same vaccinator. I know that that isn't always the most convenient, but please try if you can. If you make an appointment and then have a conflict, please call to cancel and reschedule. By canceling and rescheduling, you give the vaccinator a chance to fill someone else in for that appointment instead of having no one receive that vaccine. And when you arrive at your appointment, remember that you cannot be turned away if you do not have an ID. You may be asked for one to confirm your appointment, but it is not required to get your shot. So if you don't have an ID, simply tell the vaccinator. And speaking of getting your shot, this is a good time to mention your vaccination record. Please keep the card that you receive at your appointment in a safe place. If you do end up having to go to a different vaccinator for your second dose, again, we prefer you avoid that, but if you do need to go to a second place for your second dose, that record will be really helpful for the vaccinator. Also, just want to say we love seeing your vaccine selfies. It is a cause for celebration, and we appreciate that you want to share your experience and encourage your friends to get vaccinated, but please don't post a picture of your vaccination record card. A photo of your Band-Aid or your I got vaccinated sticker or just your smile will do the trick instead. So thank you for being with us today. And with that, I'll conclude these remarks and hand it back to Elizabeth for your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you are able to do so, use *6 to mute and unmute your phone. And we begin today with Heather Poltrock, WSAW in Wausau.
Thank you for taking my call. About a month ago, Dr. Fauci said that herd immunity in the U.S. would likely happen by the 4th of July. And I just want to know if you think Wisconsin is right on target with that date.
Well, we would be right on target assuming people keep saying yes to the vaccine, Heather. So if you look today, we're reporting the percentage of the total population that has been received their first vaccine. If you look at the percentage of adults or the people who are eligible for vaccine, we are over 50% of people have started their vaccine journey, which means we have another 30% to go to herd immunity of those eligible. And so that's very doable from a perspective of vaccine supply and vaccine access. And so we just need people to keep saying yes. And we do know that we're coming to a point where people who did not raise their hand to be first in line, and many people are thinking very thoughtfully about this decision. And we are here, and I know your healthcare provider is here, your friends and family who have received the vaccine are here, for those of you who have not received the vaccine to get more information. And we encourage you to do that and to give careful consideration to stepping up and getting vaccinated. One of the reasons we'd really encourage people to do so is to remember that vaccine is, yes, partially there to protect yourself, but it is also there to protect everyone around you. I was really heartened by a story I heard this week of a young woman who was a student up in the UW-Eau Claire campus in Rice Lake, who shared with Secretary Timberlake that at first she wasn't going to get the vaccine. She figured she was young, and if she got COVID, it wasn't going to be that big a deal for her. But she realized that if she was vaccinated, it was safer for her to be with her grandparents and other more vulnerable people in her community because she would be less likely to also be transmitting disease and could contribute to the reduction of the presence of COVID in the community. And so she raised her hand and stood up and got vaccinated at our new clinic in Barron County. So really encourage people to think about not only vaccine for you, but vaccine to protect others around you. And if people keep raising their hand and saying yes, we absolutely can get to that level by July.
Thank you for that. Let's give the next question to David Wahlberg at the Wisconsin State Journal.
Hi, thank you. Have we reached the point in Wisconsin where vaccine supply is now greater than demand? If we haven't yet, when do you see that happening? And how does that change the dynamics of vaccine allocation throughout the state?
So we haven't quite gotten there, David. We still have had more requests for vaccine than we have vaccine available to order from the federal government, but the gap is closing. So to give you a sense, for much of the last few weeks, we've had requests of about 400,000 vaccines per week. For this coming week, it is down to 250,000 doses requested rather than 400,000. And these, again, are first doses. And we have about 150,000 first doses in the state supply to distribute to our vaccinators. So that gap is closing, but we still have more demand from our vaccinators. We are hearing that they are not, many of our vaccinators are not having as many requests for appointments as they once had, and that makes a lot of sense. Think about it. 4 million doses have already been given, and so there are not going to be as many calls coming forward for each and every dose. So as supply and demand get closer together in terms of our distribution to vaccinators, it'll go back to some systems similar to how it was in the beginning, where vaccinators could generally depend upon getting whatever vaccine they requested. And our strategy of reaching out to people will change too, because it will be more targeted, it will be more focused on finding the folks who have not yet received a vaccine, inviting them to consider the opportunity to have a vaccine, and moving away from larger community-based clinics to smaller clinics in community, making it really easy for people to get a vaccine. So as we've been talking, setting up community sites in community centers, in faith-based organizations, in shopping centers, and places where people come and don't have to go out of their way to make an appointment and get a vaccine, but can easily get a vaccine when it's very convenient for them.
Thank you for that. Let's go now to Sean Kirkby at Wisconsin Health News.
Hi, thanks for holding this. Just was wondering, what do you attribute the decline in the daily averages of doses being administered to? I mean, are there any concerns that we're hitting the point of there being vaccine hesitancy or other sort of challenges? Thank you.
Well, I'll give a little bit about the numbers, and then I'll turn to Dr. Westergaard to see if he has anything further to add about hesitancy. So you saw a decline from the week of April 5th, the first week of April, to the second week of April, the week of April 12th, for a couple of reasons. One is that first week of April, we received a bolus of J&J doses. The state received 85,000 additional J&J doses. So that was a huge increase from any prior week. So we had way more vaccine in the system that first week of April. So as you look at last week, we did not have that bolus of J&J, and even, of course, because of the pause, J&J from that bolus that may not have yet been given, or any additional J&J was not available to people. So those two factors, both the first week of April having a higher level of vaccine. And then the second week of April, having the pause on J&J has certainly affected the number of doses being available to people. And that situation continues again for this week. Again, we've had a very steady state, around 150,000 first doses of Pfizer and Moderna, but no J&J at this point in time. And so that certainly has an impact on the number of daily doses. Dr. Westergaard, anything further you'd like to add about hesitancy?
So I've, in my outpatient clinic just this week on Tuesday, I had a number of conversations with patients who were still making up their mind. And also it's something that we have some survey data on nationally. And the rationale that I hear most commonly why people are wanting to wait and see or not ready right now is just the fact that it's a new vaccine, and there's some concerns that this is potentially rushed. The way that I respond to those concerns or answer questions is, first of all, to validate people's concerns. People have every right to make informed decisions about the healthcare that they use or choose not to use. And there's no wrong way to feel about getting a new vaccine. So first of all, I think it's important to validate that people have legitimate questions. And then when we talk about the concerns that people have about the vaccine being new, I tend to talk about how we learn about vaccines in general, both in terms of large clinical trials, how we look for both the effectiveness of the vaccine in preventing the disease and any adverse effects or safety signals. And then the story with the vaccines that we have has really followed that same playbook. And in addition to that, now we've been given hundreds of millions of doses around the world for these new vaccines and have gotten a pretty good sense that they're highly effective and they're very safe. So I think it's a very reasonable concern to have, and I think we have a lot of good experience where we can have those honest conversations about really, as the more we learn about these vaccines, the better we feel about their safety and about their effectiveness. And so I think bringing people along requires having these really, first of all, listening closely and being really honest and open about what we know, what we don't know, and helping people make an informed decision. I think that's the best strategy. And unfortunately, us in public health and in medicine, we've got really good vaccines, so we can stand behind them. People can take their time, get the information, and I think when most people do that, they'll see this as safe as other vaccines that we have. And when you weigh that against the risk of the severe disease and all of the really challenging things we've experienced during the pandemic, the risk-benefit ratio for most people should favor getting these vaccines, and so we're really behind it and recommend them for everybody.
Thank you for that. The next question goes to Rob Sussman, WTAQ in Green Bay. Rob Sussman, *6 will mute and unmute your phone. All right, we'll try to get back to Rob, and we'll go to Elizabeth Wattis, WMTV in Madison.
Hi. Thanks for taking my question. I know we've hit on this a little bit, but with supply going up, getting closer to outweighing demand with the 3 million people to go to get to that herd immunity, what's being done to reach those not jumping first in line to get those shots, to get them to get those shots, and so we can get to herd immunity? Is the message changing, or the outreach? What's being done to reach those people?
Well, I need to clarify something. With 1.5 million more people. So not quite as high a bar as we indicated. So I think there's a number of ways. One of the most effective ways that we know to reach people is just what Dr. Westergaard described, is through their healthcare provider. And we know many, many people that is a very trusted partner in terms of receiving their vaccine. And so we will be working with our healthcare community very closely and encouraging and asking healthcare providers to reach out to their patients who have not yet received a vaccine. Many of our healthcare systems have very robust electronic health records and can identify who in their patient populations have not yet received a vaccine and can do personal outreach to their patients. And we think that will be very, very effective. Secondly, we're including many other messengers who are trusted in communities in addition to healthcare providers. So teachers and pastors and other community leaders will certainly be part of helping us design where to host clinics and how to outreach to people, and I think that will be very important. I think the folks who have already received a vaccine, the over 2 million people in Wisconsin who have already received a vaccine, are also incredibly important messengers to talk to their family and their friends and encourage them to secure a vaccine. We also know in the days to come, it is likely that vaccine will become available for a larger group of children. There's currently an emergency use authorization for children 12 to 15 with the Pfizer vaccine. And so parents and pediatricians and others who provide care to those children will be important people to be having conversations together to think about coverage for their children. And then finally, I think the mass media will be using social media, will be using the mass media through and asking a number of different spokespeople to bring messages to folks about the vaccines to help them think about this. And I think those messages are very much what Dr. Westergaard mentioned. What he said is what people want to know. They want to know the vaccines are safe. They want to know how it's been going with the people who went ahead of them and has it been safe. They want to know why they should get it, especially if they feel like they are at very low risk themselves. So I think those are all important messages to include no matter which route we're using. And those will all be ways you will see us proceeding as we move forward.
Thank you. Let's give the next question to Stephanie Hoff at WisPolitics. Stephanie Hoff.
Hi, thanks for taking my call today. Have you heard anything from the federal level that Johnson & Johnson will get the okay tomorrow, if they're still meeting tomorrow?
Well, they are meeting tomorrow, and there will be a decision, and we will wait to see what they say. Dr. Westergaard, I don't know if you have anything further you would add to that from what you're hearing.
No hints other than that they've been, at work. There's been continual surveillance for additional cases of the rare adverse event, and the ACIP committee is going to review all that carefully and give their recommendation tomorrow, probably late in the afternoon.
Thank you for that. Let's go now to Mason Dowling, WAOW in Wausau. Mason.
Hi, I'll be posing the question for Mason. Thank you so much for taking my call. This is Chase McNamara from WAOW. My question, picking up where you were mentioning about kids getting vaccines, with Wisconsin seeing an increase in kids getting with COVID cases in kids, should school districts be actively promoting them for those 16 and older to get the vaccine, or are you guys working with DPI to get that message across? And is there other things that you guys are doing to maybe get a pushback on the legislature to make it a requirement? Thank you.
Yeah, at this point in time, with a vaccine under an emergency use authorization, I think, again, the strategies that we've been discussing about providing people with the best information to make decisions is the best approach, and that's what we'll continue to do. We do know a number of school districts are working with promoting the availability of vaccine to their mostly juniors and seniors, probably a few sophomores in school. And so, you know, I think it'll be like, go get your driver's license and then drive and go get your vaccine now, the day you turn 16. So we are making progress in that population. And I think working with schools is a very good idea. And working with DPI is a great idea too. We are reaching out to a number of parties to assist us with that, and we'll be continuing to move that work forward. It is one of the reasons I am really excited about the Vaccine Finder tool, because I have spoken with a number of people who have found it rather frustrating to find Pfizer vaccine. You can't, you know, as challenging it is to make a vaccine appointment, it is even more challenging if you're trying to find that appointment if you're 16 or 17, or if you're a parent of a 16 or 17-year-old. So it's a very important reason why we have launched this new tool, and now teenagers and their parents will be it'll be a lot easier for them to find a provider that they know has the Pfizer vaccine, because I've also certainly heard stories of people making an appointment, showing up, and then finding out they can't get the vaccine because the provider only has Moderna or J&J vaccine. So this is really another important step we've taken to move forward. And as of today, we have 21% of people who are 16 or 17 who have been vaccinated. So considering the majority of them only became eligible for vaccine a couple of weeks ago, I think we're making good progress there. Dr. Westergaard, anything you would add?
I think we do encourage as many partners as we can to promote vaccine and be prepared to answer questions. I think school districts and school administrators and teachers as well. I think we'd like to see this as a core public health message, in the same way of eating right and getting plenty of sleep and exercising is getting your COVID vaccine. I think it's the benefits are so great, particularly in light of the potential harms of increased transmission among younger people, that an all hands on deck approach to, again, in a very transparent and open way, say that this is really one of our most important strategies to prevent illness in adults and children, and we should all work together to try to, again, help people decide what's right for them, but hopefully come down on the side of getting the vaccine as soon as possible.
Thank you. The next question to Angelica Sanchez, Fox 6 in Milwaukee.
Hello, thank you for taking my question. We just learned today that the Wisconsin Center will stop being a COVID-19 vaccination site at the end of May. And this was something that was expected, as it was not meant to be something long-term. Health officials will be moving to smaller clinics, as was previously mentioned in this call, that seems to be the next trend. But is there any concern now with many more young people possibly being eligible for the vaccine, that these smaller clinics might be overwhelmed with patients?
Well, Angelica, I think that's an important thing for us to continue to monitor and to continue to recalibrate our vaccine administration strategy as we move along. And so moving into smaller clinics does not preclude having bigger events, opening a larger clinic like a Wisconsin Center, or a clinic in a school gym or another setting for several days. And so I know our friends at the City of Milwaukee Health Department will continue to monitor the need for such activities, as will our friends in public health across Wisconsin. So We've always known that at the beginning, when you had lots of people who wanted to get vaccinated very quickly, larger community-based clinics were the best option. And we've also known that those will serve a useful purpose for a certain period of time, and then we'll move into smaller clinics and, as I mentioned, community events, and integrating vaccine into the daily flow of your regular healthcare. When you really think about it, that's where we get vaccines all the time. I mean, the majority of flu vaccines are given either at your doctor's office or at a local pharmacy. They're not given in mass vaccination clinics, although some of them are, particularly at employer-based mass vaccination clinics. So whenever you have to give a lot of vaccines in a shorter period of time, we certainly use these larger clinics. When you're giving vaccines spread out over a longer period of time, that's when it's very viable to move into a healthcare setting. And so each week, as we get more thousands of people vaccinated, there's fewer left to be vaccinated, and that's why smaller settings will be more appropriate. But certainly, you know, when kids come on and that's a whole new population, that will be an important thing for us all to think about of what's the best way we can set up access so that children can get vaccinated as quickly as possible.
Thank you. Let's go now to Rachel Hotmeyer, NBC 26 in Green Bay.
Hi, thank you for holding this call per usual. With the recent news about Governor Evers allocating a significant amount of federal funding to put forth testing in schools, I was just wondering from your expert perspective how that would look and how that would be integrated to you guys. I understand every school district is different and this will be voluntary, but at the end of the day, how do you see this process working? Ideally, what would be required of a student to go do, let's say they want a test to be taken in school?
Yeah, thank you very much for that question. We have been thinking a lot about this and a lot about the best way to use that influx of a significant amount of federal money, $175 million, to best meet the needs of school districts and children and their families. And so we're thinking about a multi-pronged approach for the very reasons you said, that each district is different and has different capacities and different needs. And as the CDC directs us, it also indicates different types of testing based on the level of disease activity in the community. So to begin with, one of the things we really want to make available in as many schools as possible is the ability for the school system to be able to test children who are symptomatic right away. Because that's the most important. If we have ill students or ill staff and teachers, we need to be able to do a test quickly, identify if they have COVID-19, and obviously, if so, move them out of the classroom setting as quickly as possible, and then do the good contact tracing we've talked about all along to see who else may need to be quarantined for a period of time. So that is really important to us, and that is like the foundation of school testing, is to be able to quickly identify children who are ill, get them, children and staff who are ill, and get them tested and moved as quickly as possible. But we also know COVID is sneaky, and there are a number of people who are asymptomatic. So we're also exploring a number of different avenues for providing more generalized, what we would call surveillance testing of people who are asymptomatic. And we're looking at a number of different options, mostly looking towards the fall, about how those could be offered to school systems that want to regularly screen people who are asymptomatic. Generally, this is done with a portion of the population, not the entire population, and it may be focused in certain areas of the school. So for example, maybe in younger children, if they still aren't eligible for vaccine, as we move forward. If we were doing it today, we'd probably focus it more on older children because we know that's where disease incidence is highest right now. The third thing we're going to do is we're also going to work with our colleagues at the Wisconsin National Guard when there are outbreaks at school to mobilize them to come in and do more extensive testing in a school district so that we can quickly identify if there are other people who are ill with COVID and again move into that contact tracing, isolation, and quarantine. It's really important to remember that testing itself is not effective unless it is coupled with contact tracing and isolation and quarantine. And many times people turn to the success of the university system and how they really brought down and have controlled COVID on their campuses. But let's be really clear, that's not simply the result of testing. That is the total package of testing along with contact tracing and isolation and isolation of the people who are sick and quarantine of people who are close contacts. So we need to be able to have that full box it in strategy available in schools, or then if not, testing is not an effective tool in and of itself. And finally, I want to be really clear, testing, as the CDC has indicated, is another layer of protection on school districts. The core of protection for children in classroom settings right now is the good public health practices we've been talking about all along. It's masking and everybody regularly masking. It's maintaining 6 feet of distance as much as possible. CDC has recently said you can go down to 3 feet of distance in a classroom setting if 6 feet is impossible, but as much as possible, maintaining those types of physical distancing. And then, of course, making sure anyone who is sick is staying home from school and tested for COVID if they have symptoms, along with appropriate contact tracing and quarantine of contacts. So those elements are what has to be the foundation, and then testing adds another layer. So just want to be really clear that testing doesn't replace any of those good public health practices. It is in addition to.
Thank you for that. Let's go now to Scott Bauer at the Associated Press.
Hi, thanks again for doing this call. I think this is for Dr. Westergaard. Can you kind of talk about why Wisconsin hasn't seen a similar spike to what happened in neighboring Michigan? Do you feel like we're out of the woods relative to what has been seen there? And do you have any explanation as to what was different about Michigan than Wisconsin to have us, at least at this point, not see that spike? Thanks.
Yeah, thanks, Scott. I can speculate a little bit, but I think it's clear. It's important to say that it really is speculation. We really don't know, and there are so many different factors at play. But one factor that does seem to be measurable and consistent with what we've seen in other countries and other areas is Michigan seems to be about a month ahead of us in terms of the timeline at which the more transmissible genetic variants have become the predominant strain. We don't understand fully why this is, but when we look at our genetic surveillance of the positive tests, both our neighbors to Minnesota and Michigan have had a higher proportion. And Michigan in particular, about a month ago, started seeing larger outbreaks in congregate settings, for example, caused by the B117 variant. So, and then when you look most recently, they have about double the proportion of cases. Close to 60% of the cases being diagnosed in Michigan are B117. We're still in the 20-30% range. So that's one thing which gives me concern that we're not out of the woods to seeing a late spring, early summer surge, is that as more data have come in, these novel genetic variants are declaring themselves to actually be more transmissible. They do spread more quickly and more easily in a community. And that is one clear thing that has been different in Michigan versus Wisconsin is what percentage of the virus that's going around are those more transmissible variants. So I bring that up again, not to be definitive as that is the cause or the only cause, but it's clearly a cause of this large surge in Michigan. When you look at their epi curve, they're seeing levels that are comparable, close to the fall-winter surge that they saw. We are not anywhere close to that in Wisconsin, but looking to Michigan, I think is important to see that it actually is possible. Climate is the same, the population is similar, the landscape is similar enough that I think we ought to be concerned, and certainly don't let our guard down. Don't do anything less rigorously than we're currently doing it, because the short answer is we're definitely not out of the woods. And the Michigan experience is something that I think about and am concerned about quite a bit. So I'm glad that you brought that up. And I think the message would be that, in a comparable population, in a comparable region, this can happen. So it could happen here, and we need to be really diligent about moving forward with mass vaccination and continuing the prevention practices at every level.
Thank you. Let's go now to Eric Richards, WFRV in Green Bay.
Good afternoon, everyone. Thank you for taking my call. So my question is, as more Wisconsinites get vaccinated in the fight against coronavirus, there are still questions about the effectiveness of the vaccine. There are also reports that are circulating saying that there might be a need for a booster shot within 6 months of getting the second dose, if that's what you're doing. Can we kind of clear up the information or any misinformation that could be associated with that? And also, getting vaccinated, would that be something that people would have to do every year?
Dr. Westergaard, would you like to take those?
Sure. The piece about booster shots and the need for repeated vaccination every year, the answer, unfortunately, is clear right now that we don't know. We will be able to answer those questions when enough time has gone by and we've observed a change in the incidence of infection among people who have been vaccinated. And we just haven't seen that yet. So I think vaccine makers and vaccine distribution planners are certainly preparing and thinking about what it would take to deliver booster vaccines. But so far, there is no recommendation for vaccines because we don't have scientific evidence that it's necessary. Many people who study this and have been around viruses have some good reason to think that it very well may be. But when you look at other vaccine preventable illnesses, the timing for revaccination varies quite a bit. As most people are familiar with for influenza vaccine, it is an annual shot. But there are other diseases, pneumonia, tetanus shots, which can be every 5 or 10 years. So we won't know until we know, and there's actually a lot of surveillance and research being done about that. So if anyone says we know for sure that the protection from vaccines wanes after 6 months, that is misinformation because we don't know yet. It's not saying that it's not going to be clear that that happens, but we don't know yet. So that's important misinformation to correct. Was there that was the second part of your question, and I may have lost track of the first part. Was there another piece?
Well, actually, sir, I think you covered it. It was just talking about the effectiveness of the vaccine.
Yeah, the effectiveness data is really strong, compared to, I think the general principle that people understand is no vaccine is perfect. No medical treatment is 100% effective. When we compare the clinical trial data of these vaccines, they compare very favorably to every other vaccine on our recommended schedule. 95+%, that point estimate for the adolescent clinical trial for the Pfizer was 100%. So when it comes to preventing severe disease in particular, these vaccines are tremendously effective. So that's a solid evidence base supports that as well.
Thank you. Good information. Now to Eric Gunn, Wisconsin Examiner. Eric Gunn.
Hi, thank you very much for taking my question. We've been seeing the cases go up and down, of course, over the course of this. And at the beginning of the year, they went down for several months. They tipped up against recently. And now it does look this week like they are, again, the positivity rate is inching downward. What's the time lag between sort of a big collective behavioral change and then what you see emerge in the case counts? Does anybody have sort of a handle on that? If it's even able to be identified? Thank you.
Dr. Westergaard, you want to take?
Sure. Yeah. It's a great question. And I think the best the best guess would be as short as 2 weeks. We know that the incubation period of the virus is between 2 days and 2 weeks. So if there was a large scale behavioral change, that would be about the soonest that we would see. If it's not a large scale, if it's general trends that aren't that don't happen quickly, we may not detect real changes, and that's why we need to look we both need to zoom out and look at the overall trend and the week-to-week averages as much as any spike. So we need to pay attention to the data both on the fine-tuned and large scale. But when we look at our experience here in Wisconsin, for example, when in May of last year, when the stay-at-home order was taken away, bars and restaurants opened in some communities, it was within 2 weeks that we saw large spikes, and particularly in younger population. We saw another spike a couple of weeks after the Christmas New Year's holiday, where we think people were gathering more. So again, I think an important message is that these are, the word multifactorial. There are many things that determine what our epidemic curve looks like. But if there are large-scale forces that bring people into more gatherings because we've done away with certain restrictions, or there are events that bring people out together, it usually is within a couple of weeks that we'll see that reflected.
Thank you for that. Let's go now to Ben Krumholtz, Fox 11, Green Bay. Ben.
Hi, thank you for the opportunity. I know that you said if we have the people willing, we'll reach herd immunity by about July 4th. But how confident are you that will actually happen as we're seeing that gap close with supply and demand?
I think it's too early to say, Ben, and I am always confident and optimistic. And I think the thing that is really important here is each person who gets vaccinated is more protection for them and for others around them. And so, we set a goal of 80%. We don't, we've also said in the beginning, we didn't know exactly what the right number was. And we've made incredible progress, and we will continue to do everything we can to make more progress here. So it's very hard to say, right now we continue to see steady progress forward, and we'll see where we get. But I know that each person who gets vaccinated is, again, another person towards another layer of protection. Dr. Westergaard, I don't know if you have anything further you'd want to contribute to that.
I was thinking along the same lines, and as a physician who spends time talking with patients one-on-one and also who works in public health, I've got these sort of dual perspectives. And when we talk about herd immunity as a threshold, as a goal, and so we want to get to 80%, in my mind, if we get to 65% and it takes longer to get to 80, we've not failed in any way. We've saved many lives. Individuals who get vaccinated could result in a stopping of a transmission chain that would otherwise result in someone getting severe COVID and dying. So vaccines can save lives, whether or not we get to 80% or 50, or if we're at 50%. And that's one of the reasons that I think we should be so enthusiastic about vaccines, is that, yes, we have a campaign, we have a public health goal to use this tool to the maximum benefit of public health in Wisconsin. And if we can get to that threshold, we could actually see disease activity go down to such a low level that life will go back to normal quickly. But if we don't get there right away, that doesn't mean that individual decisions to take a vaccine, in the same way that individual decisions to wear a mask or limit gathering, can in a real and tangible way save a person's life. And that's I think another message. Like, we should not feel bad about where we're at. We should feel good every time a person gets a vaccine, because that could result in someone not dying from COVID. And that's something that I think it's important to have that perspective as well.
And one thing I'd add to it before we move on, Jennifer, is we've also spent a good amount of time looking at other vaccines and our comparison. And so in Wisconsin, we generally do pretty well compared to other states in terms of flu vaccine. And we're already at the level we usually get for flu vaccine. It's around 50%, 51, 52% in any given year. And so we're already at that level. But if you look at childhood vaccines that we do for our children, I was looking at the measles, mumps, and rubella vaccine the other day. When you look at 2-year-olds and how many of them have received that vaccine, we are well over 80% in many, many counties across the state, and close to 80% statewide. So we know we can do this. We do it to protect our children. And I would say that's exactly why we need to continue to increase our vaccine rates of COVID-19, because right now, us adults are doing it to protect our children, since they can't, anyone under age 16 can't yet receive the vaccine. So there's evidence that we are good at this as Wisconsinites, and that we've been able to achieve levels like this. So it's another thing that gives me confidence moving forward.
Thank you. Let's go now to Jessica Garachi, Spectrum News. Jessica at Spectrum News.
Good afternoon. Thank you for taking my question. I know that the meeting tomorrow on the meeting is tomorrow for the Johnson & Johnson vaccine. Does DHS have any indication of, if the pause does get lifted tomorrow, how quickly doses of that vaccine could be deployed out into Wisconsin? And then, do you think that the pause in this vaccine helps in the effort to show to people who may be vaccine hesitant that the process of evaluating these vaccines is working, and this could actually inspire some confidence, knowing that the time is being taken to really study this vaccine and other COVID vaccines? Thank you.
Well, a couple of things. In terms of your second question, there is some survey work that is suggesting that this pause may have increased vaccine confidence. In a recent survey done by the de Beaumont Foundation on April 15th and 16th, so after the J&J paused, they found that Americans were 40% more likely to accept a COVID-19 vaccine, and this was of people who had not yet started a vaccine series. So, and in discussion with some of the folks, you know, it was related to they appreciated the safety monitoring, and they appreciated the pause, and it really was a signal to them. Now, I know if you go out and talk to other people, you'll find some people who have exactly the opposite view, but from a survey done with pretty good survey technique, I think there is some evidence of that. If the ACIP says that the pause is lifted and it is safe to begin vaccination of Johnson & Johnson vaccine, our immunization providers are ready to resume as soon as that guidance is given. It is possible that that guidance may be coupled with some additional patient education materials or some additional screening criteria. So we may need a few days to adjust if some of those things happen. But we do have J&J vaccine on vaccinator shelves and refrigerators across the state. As I mentioned earlier, we had quite an influx of J&J the week before the pause, and so I know a number of vaccinators still have some on hand. And once the pause and any parameters around it are put into place, we will have people ready to give J&J. I do need to say, we also knew that we weren't going to get a whole lot more supply of J&J through the month of April. And so even if when the pause is lifted, I don't know that we're going to have a lot of new supply coming into the state quickly. Johnson & Johnson is still working through FDA approval of their production here in the U.S. Once that does clear FDA authorization, there'll be quite a bit more J&J available. And the last thing I'll say is we have also heard from a number of vaccinators who said they do have patients who are waiting for the J&J pause to be lifted. There are lots of people who don't like needles, and they just want to get the vaccine that only requires them to have one shot versus two shots. And so I think that's another encouraging sign that there are folks ready for this vaccine, but really hoping that they'll be able to get a one-dose series versus a two-dose.
Thank you for that. Let's go now to Megan Kernan, WBAY in Green Bay. Megan at WBAY. All right, why don't we move on to Sophie Carson, Milwaukee Journal Sentinel. Sophie Carson.
Hi, thanks for doing this. This question's for Julie. Aside from the federal allocation, is DHS currently still allocating doses to the Wisconsin Center through the statewide allocation? And then on the topic of the Wisconsin Center closing at the end of May, have you heard anything about how FEMA's role in the state will change after that point?
Thanks for those questions, Sophie. In the beginning, we were allocating some doses to the Wisconsin Center from the state supply in addition to the FEMA doses, particularly, well, specifically, it was second doses of vaccine that had been given prior to the arrival of the FEMA staff, but that has now concluded because they've been there longer than 3 weeks. And then the second state allocation that was being made there was we were still allocating 1,000 doses a week to the City of Milwaukee Health Department that they were largely using in their mobile clinics throughout the city. Obviously, they haven't received that recently because of the pause. The role of FEMA after the site closes is not clear, and that is largely because FEMA is an emergency management agency, and so they plan in 30-day blocks of time. And so, you know, we make requests in those period of time. So it will be conversations happening with our colleagues in Milwaukee about whether they want to request any ongoing support from FEMA to support ongoing efforts in Milwaukee. Similar processes are underway in Eau Claire and in Madison that are making requests for a 30-day period at a time. So, so we'll be looking ahead and our local partners will be deciding whether they will be continuing those larger activities where they may need that additional support. And then the request is made to FEMA and they act on it in a 2 to 4 week period slots of time. So I guess that's a long way of saying not sure, but what FEMA says to us is you always need to ask, use your local resources and your state resources first. And when those are exhausted, certainly make the request to FEMA for additional support.
Thank you. Next question to Emily Fannin, CBS 58.
Hi there. Hi there, this is actually Sharon Bajenda with CBS 58. I'm filling in for Emily Fannin. I saw a study released yesterday by the New England Journal of Medicine that, you know, less than 1%, actually 0.5% of fully vaccinated people had breakthrough infections. Just wondering if the state is tracking any breakthrough infections with fully vaccinated people. And then also saw a different study that women and the elder are just more likely to be reinfected after being fully vaccinated. I believe that was said by the CDC. Any thoughts on that and any reasoning behind that? Thank you very much.
Dr. Westergaard, do you want to respond to those?
Sure. We do have the ability, and we do track breakthrough cases, meaning people who test positive or are diagnosed with COVID-19 after getting being fully vaccinated. And CDC has requested this from all jurisdictions, and we're able to do this because we have the central data repositories for both the Wisconsin Immunization Registry, and we have the Wisconsin Electronic Disease Surveillance System. So all positive tests get reported to us, and all vaccines are recorded in our statewide system. So as has been reported in some other jurisdictions, this does happen. And as we've mentioned, vaccines are not 100%. The places where it tends to be observed the most, and there was another publication this week from the Chicago Health Department about, I think, 22 such cases. They tend to be in settings where people are screened periodically in the absence of symptoms, such as nursing homes, for example. So the Chicago investigation that was published in the CDC's MMWR showed that 80% of the time, these are people who test positive as a matter of routine asymptomatic screening in that environment, and they don't have any symptoms of COVID-19. So this is one of the things that we're still learning. We have the data to monitor this in Wisconsin as well, and what we're seeing seems to be in line with other countries, which breakthrough infections are rare, and the majority are asymptomatic or mild. Severe infections are not unheard of. There have been reported cases of some severe infections and some deaths within this country and in others, but the frequency of those, the probability of those is drastically reduced among vaccinated people in comparison to unvaccinated people. And in real world data similar to the clinical trial data, the effectiveness of the vaccines seems to be 85–90%. So again, no vaccine is perfect, but the risk of any infection and severe infection dramatically lower among people who are vaccinated.
And our final question today to Ryan Urban, Barron News Shield. Ryan Urban. All right, without Ryan, we're going over time, but we just have 2 more reporters that we're going to try to get to. So we'll try to be quick. AJ Byattpour, WKOW, AJ Byattpour. All right, how about Sarah McGrew, TMJ? Sarah McGrew, TMJ4 in Milwaukee. All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dyke, Dr. Ryan Westergaard, all of you for participating. If you had a question we did not get to, please email DHS Media, and of course, continue to monitor the DHS COVID-19 web pages for data and guidance. You can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.